The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Ron Pollack of Families USA, thanks for joining us on health08.org.
Well, thank you, Jackie, for inviting me.
I know the organization has a very, very broad agenda, particularly when it comes to healthcare issues. But what would you say is the single most pressing issue facing the country when it comes to healthcare?
Well, I think the issue of conscience is the issue of how many people can't afford to get health care coverage and are uninsured or underinsured. I think if you ask the American public generally would say the costs of health care is what concerns them the most. So I think those two issues need to be wedded together. They're obviously related to one another. And so dealing with costs and dealing with access, I think, are the most critical thing that we need to do.
Why do you call it an issue of conscience?
Well, here we have the richest country in the history of the planet, and yet we've got 47 million Americans who are uninsured. That's more than the aggregate population of almost half the states in the United States, the least populous states, of course. And so it's extraordinary to think that in the United States, where the costs of health care are far higher than any other country in the world, and yet we have such a large proportion of our population who can't gain access to coverage. I think it's a matter of conscience that we actually are a magnet for people who are wealthy in other countries to come here to get high-quality care, and yet people in this country can't get basic care. And that's something I think we need to get changed very quickly.
And so you identify access and cost as the big issues. They're the biggest issues, the most complicated ones. Give me a sense of priorities when it comes to Families USA. What do you tackle first and how do you tackle it?
I think they're interrelated, and I think you have to deal with both of them simultaneously. That doesn't mean you get everything done all at once. I don't think we're going to get everything done all at once. But we've got to make some significant incremental progress in both of those areas. If we don't deal with access, then I think we're going to see the numbers just continue to rise of more and more people priced out of health care, unable to get basic care. If we don't deal with cost, it obviously is going to have an impact on how many people are uninsured and underinsured. So I think these two matters are clearly intertwined.
Early last year, Families announced with a number of other organizations, Health Coverage Coalition for the Uninsured. Some strange bedfellows. A year and a half later, where does that coalition stand, and is it the framework for a prescription to deal with cost and access?
Well, that effort was an effort that focused only on an incremental solution on coverage. We came up with a proposal that was, I think, in many ways historic, because you never had groups like this agree on something particularly of such significance. But it was only focused on an incremental improvement on coverage. There is yet another group, many of the same organizations that were part of that first effort are coming back together over the course of this year to try to see whether we can create a dialogue so that the cooperation that's been missing with each iteration of healthcare reform, whether we can achieve that cooperation. You know, every time healthcare reform has been on the agenda, one or more major interest groups spent a fortune in opposition to healthcare reform. And I think that we need to try to get those key stakeholders together and see whether, for the first time, we actually can reach an agreement so that if a president comes into office in 2009 with a Congress, and they're both eager to try to do something significant with healthcare reform, that this time we succeed rather than fail. And that has to start by dealing with the key interest groups, the key stakeholders, so that hopefully we have a consensus about a direction of where to go. And that's not an easy thing to achieve.
Right. It's actually the strategy that was used about 22 years ago when Congress was debating nursing home reform. All of the parties that sometimes where loggerheads actually sat at the same table and there was legislation as a result of it. Who has to be at that table? How many of those organizations have given a commitment that they will be at the table?
Well, we've already had plenty of preliminary conversations. And I would say every major interest group that has been a key stakeholder in the healthcare system is prepared to sit at the table. Consumer groups, business, labor, the medical profession, hospitals, pharma. So the various groups, many of whom were blockers in different iterations of healthcare reform, are each determined to come together to try and create a dialogue. And this is not easy. What we did the last time, and we'll do again this time, is we actually hired conflict managers to shepherd us through this process. People who don't necessarily have a background in healthcare, but who are smart and thoughtful and experienced in creating a good dynamic so you can engage each other in a productive way. We found it very helpful on this first iteration. I think it'll work again, or at least be very helpful in this next effort.
Well, what happens in that situation? Does the conflict advisor say you need to leave your hard and fast principles at the door, or come to the table with your principles but be ready to be flexible? What's the advice?
Well, one of the things you learn when you do conflict management courses, and I've taken a conflict management course at Harvard and learned a great deal from this, is that you have to separate interest from position. And often we get stuck on position. Take, for example, an actress. An actress says, I want a huge dressing room, I want flowers all over the place, etc. Her position is she wants this big dressing room and the flowers. Her interest is she wants to be acknowledged. She wants people to understand how important she is. Well, maybe you could work something out that serves her interest, that also serves the interest of the producer of the play or whatever. And trying to get groups to get off of position and really drill down on interest, and then try to find ways that the positions can be combined together to match those interests. That's really the process that you try to work with. And what's also very important, and it's I think critical to the success of an effort like this, is you've got groups in the room who have always been on opposite sides of issues. And when you get together and you have a really good dialogue, you create trust. That doesn't mean you've changed your positions or your interests all of a sudden are the same. But once you create a trust, then the dialogue actually can be a whole lot more productive.
And so for Families USA, that means coming to the table not with a specific proposal such as single payer or a mixture of private and public or price controls or this or that. It means coming to the table with what?
Well, we have our preference in terms of an approach to health care.
Which is?
Well, our view is that if we're going to get anything done, there's going to have to be a mixture of public and private sector initiatives. That's the real gulf that exists between conservatives and liberals, between Republicans and Democrats, and often the special interest groups versus those that have traditionally been supporter of health care reform. And I think that we have to find a virtue out of everyone's second favorite choice. Each of us comes into this process saying, here's our top priority proposal. And in the past, if our top priority proposal did not get adopted, we either walked away from the table or we opposed what's left on the table. And another way of saying that was all of our second favorite choices was the status quo. And we have to find a virtue out of a second favorite choice that isn't exactly what we came to the table with in terms of our first choice, but something that actually is substantively sound and politically achievable.